Do you ever feel like your days are being dragged out in the same constant loop? As if you must keep on going with everything to keep everyone happy, but not find any happiness yourself? How many times have you thought if it's worth all this trouble to keep on going? Today, I would like to talk to you about depression within college students. As a student in college, there are days or even weeks that weigh more on me than any other day. I have researched this topic not only to be able to understand the reason why most college students fall into depression, but also to inform you about the different resources that are available to help them cope. The information I will be sharing with you today is important because you are all students trying hard every day in school, putting everything first except yourself. What you will hear today may help you figure out ways to better yourself, not only for the people around you, but most importantly for yourself. During my speech, I will discuss what is depression, what causes depression in college among students, and ways to treat and cope with depression. Not many people think or understand what depression or symptoms of depression is. Depression is a common and serious mental illness that has no known cause and several distinct symptoms. Depression most likely results from a combination of genetic, psychological, and environmental factors. Trauma or any stressful situations may trigger a depressive episode. In addition, some of the most common symptoms of depression are fatigue, insomnia, early morning wakefulness or excessive sleeping, overeating, loss of appetite, lack of concentration, persistent sadness, empty feelings, and feelings of guilt. Depression can also coexist with other mental illnesses, such as anxiety disorders, or even with other serious medical illnesses such as heart disease, cancer, etc. Now that I have described what depression is, I will explain what causes depression amongst college students. Depression amongst college students has multiple causes along with the symptoms that may vary from each individual. More than half of college students suffer from guilt and dissatisfaction, as well as being characterized by fatigue, indecisiveness, and pessimism. A large portion of students in higher education are alone with their problems, bad moods, a sense of guilt, and trying to use coping strategies to overcome the tensions caused by school. Now that I have explained what causes depression amongst college students, I will inform you about the different ways to treat and cope with depression. For college students, it can seem impossible to treat and cope with depression. However, there are a series of treatments and ways to cope with depression that are easily accessible to students. As students, our problems seem to be more complex because we deal with both our student and personal life. Therefore, as a student dealing with depression, it is common to take a different route of treatment than the typical treatment of depression. The typical treatment for depression is cognitive behavioral therapy, also known as CBT. College students treated for depression are also treated with CBT, but with modified forms of it. The reason for modifications is because as young adults, we are still developing cognitively, and therefore are modified according to our developmental stage. Coping with depression can vary from person to person, and is different for everyone. Some use medication for treatment, others make difficult changes in their lives. Students can use different coping mechanisms such as following dietary restrictions, increasing exercise, monitoring one's health, as well as having mental health appointments. Self-care behaviors and medical adherence are important parts of coping mechanisms as well. In conclusion, depression amongst college students is more common than imagined. New treatments are constantly being tried and modified to better fit the lifestyle and mindset of college students. Today, I have informed you about depression amongst the college student population, the causes of it, and the ways that students can treat and cope with depression. There are days or even weeks that weigh more on me than others. This being my first year in college, I have found myself struggling to balance my personal and student life. As a perfectionist, I have a sense of pessimism when my work does not meet the standards that I set for myself. This then leads to dissatisfaction and a lack of motivation for my work, as well as guilt for not meeting the duties that are set for me at home.